Hello everyone, this video will give you 5 special tests to detect signs of rotator cuff tear. Here are the 5 special tests. The first one is the Shrug Sign test. The patient will abduct arm to 90 degrees in the plane of the body and to hold that position briefly. A positive test is when the patient had to elevate the whole scapula or shoulder girdle, shrug, to lift the arm to 90 degrees. The second test is the empty can test. The patient resists downward pressure exerted by the examiner at the patient's elbow or wrist. A positive test when there is sign of weakness, pain, or both during resistance. The third test is the arm drop test. The examiner asks patient to actively elevate the arm in the scapular plane, then ask the patient slowly lowering the arm down. A positive test is when the arm drops suddenly or the patient experiences pain. The fourth test is the lag sign test. The elbow is passively flexed to 90 degrees and the shoulder abducted to 90 degrees and is held 5 degrees of maximal external rotation to avoid elastic recoil of the joint capsule and the scapulothoracic joint. Positive test is when the patient cannot maintain the position and the shoulder rotates internally. A positive test is when the patient is then asked to maintain the position actively while the examiner releases the wrist while maintaining support through the elbow. A positive test is when the patient cannot maintain the position and the shoulder rotates internally. The fifth test is the lift-off test. The patient stands and places the dorsum of the hand against mid-lumbar spine. The patient then lifts his hand away from the back. A positive test is when the patient shows inability to perform this action, indicating possible compromise of the subscapularis muscle.